Hello, everyone. Valerie Stern and I are back again talking about when patients come in who are entrusting us with their appearance, never mind their health, their, feeling good, looking good, etc. When they come in, how do we evaluate them, our aesthetic eye? And the reason we're doing this is because I think it's increasingly important. Certainly, we see people who have not been well served.
Yes.
And my aesthetic is you should never be caught having things done, like not the big cheek, not looking really Botox, not looking like you've had threads that make you look horrible, whatever it is, whether it's technology or injectables or whatever. I mean, we want you to look yourself optimized.
Completely.
So I'm going to interview you. I'm going to do the hot spot first and say, okay, for instance, I mean, me or whoever, when people come in, okay, and they say to you, here's what bothers me, okay, and you're looking at the whole person, because we look at the whole person.
Exactly.
So how do you evaluate people? People come in, they sit on the bed, and they go, what do you think I should do?
That can be a tough one. Number one, I want to know exactly what they're thinking in their head, because I never want to put something in their head that they're not thinking about. Mm-hmm. There is nothing worse than saying to somebody, well, what about all of this going on down here? And they're like, oh my God, this was all I really wanted. Then you've set them up.
Exactly.
I
feel bad about themselves.
Yes, and then they're like, wait, what? No, I do not want to do that. I respect them. I want to know what bothers them. I got plenty that I could be doing to myself right now. Does it bother me? Some does, some doesn't. Somebody else might be bothered by it. I don't care. So we're all a little busy with that. We're busy. Yeah. I mean, we all are busy anyway. So I do want to know what their focal reason for being there is, or what bothers them. Some may just say, you know what, I've reached a certain age that I just feel like I look tired. Somebody keeps asking me at work, what's wrong with me? Nothing's wrong with me.
Did I sleep well?
Exactly.
Yeah.
And I just think I need an overall refreshing. So you tell me what you think. And so then they sort of do throw it into my hands. And so what I want to do is I want to look at them, and I want to just kind of make sure that I take what they have and I point out the very good parts, and then look at the things that maybe we could consider, but in such a way that I ask them about it first, so that we're working together as a team. And so I might just say, you've got beautiful eyes. Your eyes are the focal point. When I look at
the window to the soul.
Exactly, which they are. And, maybe we could, what do you think about your eyes? And they may say, I'm fine with them, or maybe I'm not, or I've got wrinkles.
Even though we're looking at a lot of lines or whatever. They don't care about that.
Exactly. And then it may just be something as subtle as all of a sudden you get down to the lip area or the sides of the mouth, and it's that what we call the oral commissure, or somebody referred to it the other day as a puppet line. Puppet line.
Oh, yeah, the puppet line.
I love it. And I'm like, that's brilliant. Yes. And that was the whole issue. And if we could just raise that up a bit, they felt
where their mouth is down turning, and they've got these big marionette lines.
Exactly.
Yeah.
And by just discussing that, I learned a couple of things. That, the browns or the reds on the face weren't their problem, or weren't what they were coming in for at that moment. It was kind of giving that face an appearance to where they didn't feel like they looked sad or stressed.
Or angry.
Exactly. So, I then start looking at this in my brain, and I'm thinking, okay, well, what could I do for the sides of the mouth? Well, there's a couple of things. I could discuss filler. I could discuss threads. I could even discuss Forma with them.
Or Botox. If they have these big, or all of the above.
Exactly. If they have a thinner skin or something along those lines, and I am going to consider something like a technology, radio frequency, or Forma or something, then I may want to look at their skin. If they've got a lot of buoyant, thick skin, and they don't necessarily need a lot of lift here, but this just turns down, I might choose something else. Threads might be a better option.
And what you're talking about is that people have like more genetically. It doesn't have anything to do about your size.
Right.
Genetically, you have more fat under your skin. Some
Exactly.
people don't have much fat.
Not at
and
all.
that's genetics to a large extent.
They just tend to have more of just a finer quality of skin on the surface. And in some cases, pulling that might not do as well with a thread or something than somebody with a thicker skin.
And this, we're talking about also people we see who have rice paper
Yes.
thin skin. That's the epidermis
Exactly.
that needs to be thickened, whereas the dermis may be thick. They may have jowls, but the skin, it's so delicate that you've got to do something to thicken that skin. Skin
Exactly.
products.
Skin products, exactly.
Number one. And then radio frequency.
Completely.
Yeah.
So, looking at these things, we might decide that we're going to give them a bit of a treatment list. And it's going to include maybe a lot of things on the wish list that they might want to consider doing in the future. And then we'll pick something that day that we might be able to just do that's going to give them a little bit of a boost for that time, and then suggest things that are just going to help their overall appearance in the long run. It's exciting. There's an enthusiasm about it. And when you work together with them and you give them a plan and you explain how you're going to do it and why, to me it makes all the
An
difference.
action plan.
Yes, an action plan.
And based on, what are their primary concerns? And then it's like you said in the other video that you get rid of one thing and then something else starts to bother them. So you're treating progressively.
Exactly. And this is good because we're doing a little bit here and there, maybe all the time, but at the same time, we're stimulating that collagen, we're getting that skin into shape, we're using products, we're using technology, and everything we do is a step in the right direction that's taking age off of that skin.
And it's just like you get your body in shape, you have to get your skin in shape.
Exactly.
It doesn't just presto happen overnight.
Nope.
And it's a progressive optimization from where you are to where you want to be.
Exactly.
Understanding that we can only do so much. The earlier you start, the better.
Yeah, definitely.
Because it slows down the clock. I mean, when people come in, let's talk for a second about people who come in, 65, 60 something, and maybe they haven't taken care of themselves internally. They really haven't done anything. They've been busy.
Right.
They may not have had the money to do anything. They may not have known about it. A lot of people don't know what their options are.
Yeah, there are many reasons. There are people that just don't go to dermatology. They've been seen by family medicine or whatnot, wherever they live. My mother was like that.
And it's like one of my pet peeves. When people have shingles, they need to put things on the surface of the skin. They don't just need to treat the shingles, which family medicine often does. But so somebody comes in at 60 something, somebody's getting married, and all of a sudden they want to be a lot younger.
Yes.
So talk about our challenges there.
Well, first of all, hopefully it's going to be a fairly decent engagement, a long engagement, so we have the time that we need to do this. Because
they give us a lead time.
Yeah, give us a little
year
time.
or so.
And even the bride herself, I have to say, they need to expect, let's look at this in terms of a year or so. Because some treatments, when you're building collagen doesn't build overnight. If we look down
3 months, 4
Exactly.
months, 6 months, a year.
Completely.
Yeah.
Those little cells are knitting away like crazy down below, but we can't see it happening. We just wake up every morning and say nothing's happening.
And if you're stressed out, it slows it down.
Yes.
If you're not sleeping, if you have insomnia, if you have, all those
Hormonal
issues,
irregularities, not
all
eating
that
right.
stuff, your thyroid's low, your adrenals are low, all that slows it down even more.
Completely. So every few steps we take, we may have a step or two backward. So getting the right time frame is important. And then doing an action plan, as you mentioned, where we kind of plan out what we want to do and do it in a timely manner so that we can get, if there is anything more aggressive with some downtime or whatnot, we can get those out of the way first. I know some people think, well, I don't want to do this quite yet because I want it to be fresh for the wedding or the anniversary or the reunion. But the thing is that you don't want it fresh.
Yeah. No, you don't want it fresh.
You want it to look like it's been there for
because it builds over time. And it's, for instance, like lip lines, okay? I have patients who the muscles thinning, the teeth are thinning, everything's thinning. And so with lip lines, look, you can put Botox in there, you can put filler in there, but you don't want to look like you've got these huge injected lips. And now you can put some textured threads
Right.
in there that help fill it in. You can weave it into the muscle. But these things you have to start way ahead of time.
Exactly.
Because it takes months to get the result.
Exactly. And I mean, no matter where you go or who you see, if they tell you that collagen is going to happen instantaneously, I'd kind of run.
I get a second opinion
Yeah,
for sure.
because I mean, sure, there is one little level of collagen that may snap up quickly, but that deep reticular collagen that's way down there, which is the foundation to holding everything, it takes time. If you've ever cut yourself or whatnot, you know that something just doesn't
And
go
we
from
heal much more slowly
Yes.
as we go down the path of life. And that means that our collagen production is much more slow.
completely.
Okay, let's talk about a couple of things
Okay.
that people really worry about.
Okay.
One of the things that I have, and it's only recently that we have some good options for that, is like, you don't have it, but people who get like these fan-shaped little vertical lines
Oh, yes.
where their
In the brow.
eyes, and so there's only so much Botox we can do, otherwise we drop your brow,
Exactly.
etc. Well, now you can put threads in there, but there's also, look, we do radio frequency with
Right.
that. We do clear lip, we do Morpheus, we do, but it's oftentimes it's the synergy of those.
Yeah.
Sometimes people, when they have lines in their
Right.
brow, okay, we sit there and we think, okay, should we put a little bit of filler in there? Well, well-conducted filler is a good thing.
Right.
Botox stops it, but sometimes the lines don't fill in. We're using vitamin C, we're using retin-A,
Exactly.
we're using the vitamin A pluses, we're using exfoliation, etc.
And I'm a perfect example of that. You can see, I have Botox, just a bit, but I still have a bit of a line. Much
and
better
that's
than
just
it could
muscle,
be, but
that's genetics.
exactly.
Okay,
It's
that's just your anatomy. And so sometimes what we do is we'll put a little bit of filler in there. Now you can put some threads in there, but sometimes it's easier and better
Right.
and very long lasting to just put some filler in there. Okay, with lips, again, we've talked about the threads there, the Botox there. Look, the chin, a lot of people hold tension in their chins. We put some Botox in there.
Yes.
You notice people's chins and they lose their fat pads.
Yes.
We put filler in there. It lasts a good long time.
Yeah, it really does. There's not a whole lot of movement going on down here. So it does tend to last for a fair amount of time in this
and then
area.
also the other thing is we see people who they come in and whoever's put a whole bunch of filler up here and they look like chipmunks. It
Or
looks-
Martians, yes.
it looks terrible. And instead, I mean, we're looking at from an aesthetic eye over here, because what they've shown is that the cheekbones over here on the side start to thin.
Right.
And so what we're trying to do is put a little bit of filler over here.
Mm-hmm.
Sometimes it's threads. We have to look at it and sort of decide
Right.
what's going to give you the most long-lasting result, cost you as little money as possible, cost you as little downtime as possible, and give you the results you're looking for. Sometimes it's about putting some filler here. Sometimes it's about putting filler along the side of your ears here, okay? And sometimes it's about putting a little filler here.
Right.
One of the things increasingly we're geared into is to pull out the angle of the jaw so long, narrow faces are widened a little bit more like they used to be. I mean, threads help us, our fat pads, okay? Fall.
Yep.
Skin products are helping that. Radio frequency is helping that. Morpheus, Clear Lip, Lumecca to a certain extent. But then sometimes we have to take a thread and go down there and get the fat pad and pull it back up.
Exactly.
But so we're looking, and then also when we look at you, we're looking at, are those brown spots what everybody's looking at? I mean, what do people see?
Exactly.
Part of what I do, and I know you do, is look at when other people are looking at you. You want them to go to your eyes, your beautiful eyes.
Exactly.
And you don't want to have these great big lips. You don't want to have these great big things that keep people from coming to the eyes. But is it your brown spots? Is it the lines?
Right.
I mean, we both have people who say, oh no, I don't want to have Botox. But those lines are driving people crazy. And they don't see their eyes because all they can see is these lines.
Exactly. There's so much truth
And
to
so
that.
we say to you, well, we start having a conversation with you about Botox, etc. necks, etc. Look, radio frequency.
Radio frequencies are great
sometimes
one
it's
for that.
threads,
Mhm.
skin products, etc. But
Morpheus,
absolutely,
intensive, things of that
thickening
sort.
the skin.
Yeah, thickening the skin. That's honestly, you cannot go wrong thickening the skin. That is so important. And I think that's one of the reasons too why technology is important, because it thickens the skin. Instead of going under
CO2.
exactly.
Turning on those stem cells.
Yes. Instead of going under the knife and pulling that thin, damaged tissue.
So you look like a skeleton with thin skin pulled over.
Exactly. So exactly, that's just it. You don't have the healthy skin. So what we're doing is creating healthy skin. We're giving that skin back.
Beautiful, healthy
Exactly.
skin.
And that makes a big difference. You can see when somebody looks good because their skin is healthy versus somebody that's just had maybe a bit of laxity and it's been pulled and sutured up and the skin hasn't been touched. Internally, they may not be healthy, they're not using decent products, and the skin is just thinning. And the average lifespan of a facelift or a blepharoplasty or a forehead lift with skin like that is probably not all that long. I think the average is somewhere around 6 years, 6 to 7 years.
Well, and that's
Depending.
the other thing is forehead lifts have pretty much gone away
Right.
because of radio frequency, basically.
And
Okay, and
imagine
certainly
threads, too.
threads.
Yeah.
Okay, I mean we can take eyelids and droopy lateral eyes and and put threads. So when we're looking at you, just to wrap this up, okay, when we're looking at you, we're looking at everything. I mean, when I look at people in the grocery store, I can't help but see, because that's what our
Right.
eyes are trained to do. We're not judging, we're just evaluating as we're trained to do every day. And what we're trying to do with these videos is say to you, when you go in to see people, how are they evaluating you? Again, knowledge is power. We're trying to teach you how you should be evaluated, all the different tools that are available to you, and then having somebody who has a good aesthetic eye that doesn't make you look done, because it is not a good look, and you become identified by being done rather than looking your personal optimized best, understanding that you're never going to look 21 again.
Exactly.
The earlier you start, the better. Doing a little bit on a regular basis is the key, but well conducted little bit every.
Exactly. One other quick thing, I'll make this quick, but I do want to bring this up. This is a point that I've seen, and I know you've seen this too. Somebody will call and say, oh my goodness, my sister just had treatment X done. She looks amazing. I need to have it done. When can I get in? Sister comes in, treatment X is not for her. Do you know what I mean?
Correct.
And then they have a bit of a like, what do you mean? My sister looks so great. But sisters are completely different in many respects.
Even twins.
Exactly.
Identical twins.
Exactly. So that's another thing that we're evaluating too. We're not trying to say, oh, we don't want you to have that treatment. If that treatment is right for you, we're happy to do it on you. But if we feel that there is something that would serve you better, or your situation might be just a little bit different, maybe your skin's not as thick, or maybe your skin is thicker, or whatever, we're going to optimize you so that it's unique to your needs.
And I'm going to leave you with a story that I told Valerie, which makes us both very depressed, because we have to deal with people on a regular basis. A very famous cosmetic dermatologist, I was at a meeting who somebody stood up and asked him, he's a big laser expert, technology, whatever, supposed to be an expert on all the different modalities. And they said, when patient X comes in and they're complaining about X, Y, and Z, how do you decide what to choose? And he said, and I've never forgotten this because it made me physically nauseated. He said that I use whatever technology is in the room, that is in the room with the patient. That's wrong. And so we're here, we're doing these videos to try to give you knowledge so that you are always well served and not poorly served. So hope this helps. Thank you. We're always interested in what you'd like to hear us talk about.
Definitely.
And thank you very much.